Okay, so we're looking at the sheep's heart, and the way that when I watch the video on YouTube, is the interventricular sulcus, the anterior one, is going to come almost like perpendicular or at an angle to the apex, whereas if you're looking at the posterior, it's more just going to come straight down. So that's kind of a way. I also know that what's anterior is the first blood vessel that's going to be the most anterior is going to be your pulmonary trunk. So let's start with the atrium. So the easiest way to tell that if you're in the atrium is if you're seeing these little cords called the chordae tendineae. So we're in the right atrium. And so we have papillary muscles, and also pectinate muscle is located here. We have the right auricle of the right atrium. And then this valve is going to be your tricuspid valve. And what holds or avoids the back, the valves going inside out, is going to be these chordae tendineae, which is held by these papillary muscles. And then you have these trabeculae carneae, and it's a little bit easier to see on the left ventricle than it is on the right. Another way you can tell if you're right or left is the myocardium in the right ventricle is going to be a lot thinner than in the left ventricle. And then also we have the moderator band, which is only located in the right side of the ventricle. So then if we flip it over, the way that you know that you're only in the ventricle, can you see that? Is you don't see any chordae tendineae. So that's the difference between the valves between the major blood vessel and the ventricle, and the atrium and the ventricle. Is the atrium and the ventricle, you're going to have the chordae tendineae, whereas the ventricle to the major blood vessel, you're just going to have the three valves, or the three little, pockets, and that's going to be 1, 2, and 3. And then this is, because we're dealing with the pulmonary trunk, this is going to be the pulmonary valve, and what comes out is here. Something I forgot to mention is the major blood vessel that supplies the right atrium, which is going to be your superior vena cava, and then you can kind of come in through here, and that's going to be your inferior vena cava. So superior and inferior vena cavas. And then the coronary sinus and the fossa ovalis is a little bit more difficult to determine, so that will be TBA, to be announced later at a later time. Okay, so now we're going into the left side. So an easy obvious of being in the left side is this thick myocardium. So you would say this is the myocardium of the left ventricle. So what you guys did was you guys cut through the atrium, so the valve is cut in half, but we're talking about the mitral valve or the bicuspid valve. You don't have to say them both, you can say one or the other. And then of course you see the chordae tendineae, you see the papillary muscle, and you really can see that trabeculae carneae down here. So all of this down in here is your trabeculae carneae. And then here you have a blood vessel that comes in through here, and that's going to be your pulmonary vein. So remember, any blood that comes to the heart, that vessel is going to be a vein, and anything that goes away from the heart is going to be a artery. So although it has oxygen, it's going to be a vein because it's coming into the heart. Okay, so now we cut all the way through, and so now we're in the aorta. And again, you can tell that we're in the left ventricle because you have the three little cusps, and that's going to be the aortic. And then also you have, back in here, you have your coronary arteries. So I think this one is going to be your coronary artery, is that right? Back in here. And then this one in here is going to be the other coronary artery. So this is going to be your right, and then this is going to be your left coronary arteries. And then this is going to be your aorta, and then this is going to be your brachiocephalic trunk, I think is what it's called. And then again, you have your auricles. You have the apex. And I think does that seem right? That's it? Okay, yeah, that's it.